Okay. Hello, Dr. Lin. My name is Corinne Everling, and I'm going to be talking about mesothelioma. So, what is mesothelioma? It's cancer in the mesothelium, which is a thin layer of tissue that covers many internal organs. This cancer is specifically in tissues around the lungs, abdomen, heart, and testicles. It's fast growing and it's very difficult to treat. There are treatments, but for many, it proves unsuccessful. Um, I'll get into why the survival rate is so low, but the treatments aid in longevity of the patients, but it is mostly fatal for these patients with can that get this cancer. So I'm going to be talking about pleural mesothelioma. It's the one around the lungs. That lining is called the pleura. It's largely caused all of this cancer, mesothelioma, is caused by asbestos. It's a fibrous silicate used in building materials. Um, it's heat and corrosion resistant, so it's pretty essential for construction. So it's pretty widely used today still, but it is a dangerous material. Epidemiology, so there are 3,000 new cases of it each year in the United States. The survival rate is 5 to 10%, and it's been like that for the past 5 years. Males are more susceptible to getting it because they are at higher risk of exposure. There's more males in the construction field, so they're going to be the ones that are going to be getting this cancer. White non-Hispanic males are more susceptible to mesothelioma, and then cancer is not visible until 15 to 40 years after exposure, and age of diagnosis is 74. Um, this is kind of sad to think about, though, because it's not that the cancer forms 15 to 40 years after exposure, it's that um, it's visible after that time. So the people who are getting diagnosed, they are pretty long into this cancer, so this they're going to be pretty high up in the stages. It's going to be harder to treat. That's kind of why the survival rate is so low for it, because these people are going to be having it at very severe levels. Risk factors. So basically, anywhere where you're going to be exposed to asbestos, you're going to be at risk for this cancer. Exposure at work, living with someone who works with it, living in an area with deposits or mines with it, living or working in a building where it's been disturbed. This material, it enters the body pretty easily. So really anywhere where it could be able to enter you, you're at risk. Signs and symptoms: chest pain, painful coughing, shortness of breath, lumps under the skin, tiredness, and weight loss. These symptoms are really just for pleural mesothelioma. Tiredness and weight loss, those could be for the other ones, but the first four are for pleural mesothelioma. Diagnosis. So the first thing that is going to be performed is a physical examination. You're going to be checked for lumps and other signs. Then you're going to have the CT scans or the X-rays. Those are kind of broad imaging machines that kind of give you an idea of where this mass could be located. Biopsies are very helpful. They're performed where a tissue sample is taken from the area of suspected cancer, and then it's sent to the lab to be analyzed and looked at. Cancer cells are pretty different than normal cells. Their nucleus is bigger, they're way disorganized. So getting a biopsy is very helpful. If you see that cell, you can immediately tell if it's cancer. So they're very helpful. Once it's confirmed that you have it, MRI scans and PET scans are useful to measure extent and stage based on severity. Um, these are just higher resolution than the X-rays or the CT scans. They just give you a better visual. So, they're used to measure the extent and the stage. Alrighty. So genes and pathways. Um, Bear with me when I go through this because it is a little confusing. Um, but yeah, so there are 17 pathways that aid in the development of pleural mesothelioma. Um, there are a couple proliferation and survival pathways. We have the MAP kinase pathway that stimulates cell division and growth. We got the P13 one that promotes survival and resists apoptosis. We have NFKB, AP1, PKC ones. Their transcription factors and enzymes that amplify inflammation and growth. And then the COX-2 promotes inflammation, angiogenesis, and tumorigenesis. On the left, we have the MAP kinase pathway. There's a lot of moving parts in it, but end result is transcription factor aiding in the transcription of these harmful cancerous genes. So more growth factor, more genes and pathways. So we have the growth factor genes. We have the epidermal growth factor receptor. We got the vascular endothelia growth factor receptor, and then we have the CMET growth factor receptor. On the right, this is the P13 pathway. You can see the EGFR being used to help P13 phosphorylate that PIP and then cascade down to proliferation. This EGFR is used in a bunch of different pathways. We can see it's in the MAP kinase one, but it's a very universal receptor. It's in the macrophages that we talked about recently. That helps in the entrance of tumor cells in the blood vessels. So it's just a very universal receptor. It's used in a lot of these pathways. More pathways, we got the metastasis pathway that uses MMPs that are enzymes from the created from cancer cells that help break down the ECM and basal lamina. It enables intravisation, which is one of the steps of tumorigenesis and metastasis. High levels of this is worse prognosis. You know, it's in more areas of the body or it's um, higher motility, so it's, you know, getting in more places. So higher levels of the MMPs is just not a good sign. Then we have the WNT pathway. So I took this photo again from the lectures. It's another one that helps cell proliferation and development. You can see as the WNT binds to the two receptors that aids in the beta-catenin binding and helping translate or transcribe these target genes that are harmful genes. This photo is not from any of the websites, but it is a really helpful photo, and I don't want to spend so much time on it. But it's just a great visual of how many different pathways there actually are, how many moving parts there are in um, aiding in the development of this cancer. So this kind of is why it's just a very tricky and hard cancer, is because there's just so many moving parts that, you know, one drug isn't going to solve all of this. It's not going to inhibit all of these pathways. Um, so it's just, and it's also specific to each person, so it's just a very hard cancer to fix. Treatments are we have surgery, which is done basically every time there's a patient with this cancer, just because they're going to be already really far along with this cancer. So removing as much as possible is just the best route. Then we have the radiation therapy, which kills the cells, disrupts the cellular function at the DNA level. We got adjuvant chemotherapy, which destroys it after surgery. We have neoadjuvant therapy, which is before surgery. And then this is one of the main medications out, Keytruda. It's an immune checkpoint inhibitor. Basically, what it does is it stops PD-1 receptor from binding to cancer ligands. So what cancers will do is they will overexpress these ligands that bind to the PD-1 receptors around T cells, and it will essentially stop the T cells from functioning, which is really not good. They're pretty essential for immune system health. So this Keytruda will go in and it will stop the PD-1 receptor from binding to the ligands, and it will essentially let the T cells function as best as they can. So it's a pretty efficient drug. Then we have new treatments in clinical trials. Hypothermic intrathoracic chemotherapy is a new chemotherapy in clinical trials. It's having positive feedback, increasing the longevity of patients up to 35 months. It uses heat to go in and essentially break open the um, cell lining and the cell membrane, and it allows other medications to enter and kill the cells from the inside. So it's used with a combination of other medications, but it's very helpful. And 35 months is a lot of time, so it's pretty good drug, pretty good chemotherapy. Um, Next one is neoadjuvant cisplatin, pemetrexed, and atezolizumab combination after surgery. It proves successful in increasing longevity of patients. So, yeah. And then these are all my references. Thank you.